Hi, I'm Lindsay Johnson. I've been a radiologic technologist for almost 7 years. I've been working in MRI since 2021. Today we will be discussing the cross-sectional anatomy of the brain. The objectives of this lesson: planes of image acquisition, the lobes of the brain, and the brainstem. When breaking down the cross-sectional anatomy of the brain, we need to look at the imaging planes that they are often obtained in. Localization for MRI is obtained in these three basic planes as well: axial, sagittal, and coronal. It's important to distinguish the cross-sectional anatomy in different planes so you can plan your next sequence. When setting up your scan plans for MRI, if you don't see the anatomy you need, it's important to relocalize. It's only an extra 30 seconds typically. Images are obtained like slices of bread, so the planes are in the direction you're getting images in. In CT, the images are obtained in a helical manner. The X-ray tube spins around the gantry. With MRI, the slices are obtained as in every other slice as a manner to reduce artifact. MRI artifacts are a whole separate in-depth subject. Sections of the brain include the frontal, parietal, temporal, and occipital lobe. The brain is also divided into the right and left hemispheres and the cerebellum. The right and left hemispheres are separated by the longitudinal fissure, and the cerebellum is separated from the brain by the transverse fissure. And that'll be right back here. The axial anatomy of the brain will be the most common imaging plane for MRI and CT. In the figure, all of the lobes are visualized. The thalamus, which is the little violet part, is above the brainstem, is starting to become visible. Not labeled on the image are the dark areas in the middle of the brain. These are the ventricles where the cerebrospinal fluid, or CSF, circulates. There are two anterior horns of the lateral ventricles, right here, and two occipital horns of the lateral ventricles, right back here. Here's the sagittal view of the brain. It allows for the most structures to be imaged, including the brainstem. The brainstem is composed of the midbrain, pons, and medulla oblongata. Above the brainstem is the thalamus. The large section above the thalamus is the corpus callosum, which connects the two cerebral hemispheres. Also visualized are the ventricles, which circulate cerebrospinal fluid. Here's that corpus callosum, and this dark area just above this purple thalamus is a ventricle. This dark space back here is also the fourth ventricle. Like the sagittal, coronal cross-sectional anatomy, you can obtain a lot of information on many different structures of the brain. The frontal, parietal, and temporal lobes are visualized, as well as the thalamus and entire brainstem, midbrain, pons, and medulla oblongata. Coronal is not run as commonly as axials. For instance, with a protocol with 7 sequences of the brain, you might run 1 sequence. Coronal sequences of the brain can be used to locate specific structures. You can reduce them to about 2 minutes. It's not typical you would run coronals the same way for different protocols. The sequence is always angled with specific anatomy. For example, protocols for seizures are angled with the temporal lobe. Some are dynamic images just through pituitary. When cranial nerves are the goal, thin slices are obtained through the auditory nerves or optic nerves. Some of the anatomy not covered in this lesson are the meninges, circulation, like arterial and venous structures, and the 12 cranial nerves. This is just a basic snapshot of the cross-sectional anatomy of the brain.